Y'all, I'm trying to look half decent for these videos. Trying to look like myself again. Alright, so what we're going to do is we're going to talk about medical surgical nursing and how I study for that and how I pass. Now, as you know, when I got into surgical nursing, it was like really a tough subject for me, but that's because I did not understand it. It is not like college or high school or anything where you have to basically memorize everything. No, you need to understand it from the bottom to the top and out. That is just how nursing will go. If you don't understand it, that means you can't do it out there in the real world, okay? So, what I did when I first grasped it was I needed to learn my teachers. That is the first thing we need to do when we get into nursing school is to learn our teachers. Please, please. My first teacher when I went in, she was a great, great teacher. She told us this. Here's your lecture packet. Anything on this lecture packet is what's going to be on the test. I'm not tricking you. I'm not doing anything. You don't have to go back and read unless I tell you to. Everything is what I wrote it down for you. I would literally go home and just flip through these pages and ace their test. Just like that. Now that was just for her exams only. Now the second teacher, she would do the same thing, lecture packet, and then she's one of those teachers where you have to bring out your pen and you would have to add in notes because she'll be talking about everything from the lecture packet, but she would keep adding on and she would let us know, hey, notes, write it down. And I would write it down. Now, third teacher, the teacher that we all hate the most is the teacher that don't barely teach not a dang of nothing, that's barely there. She sometimes don't even know what she's talking about. Sometimes you gotta even correct her. Okay, there's really a method for that. I got something for that, okay? Okay, medical surgical nursing has a model basically to it. All you really need to know is when you have teachers like that is you just go based on the model. So it's going to be pathophysiology. You're going to need to know the etiology. You're going to need to know signs and symptoms. You're going to need to know the risk factors. You're going to need to know the treatments. You're going to need to know the interventions, the nursing implications, and the nursing health educations. It goes into something like that. Now, every disease process that they give you, you might not need to go in depth of what I've got given you, but you're going to need majority of that, such as patho and eto and signs and symptoms. Regardless, you're going to need to know that in order to understand what the question is asking you. All right, to add into what I mean by pathophysiology, let's start in. We have the pericardium, the epicardium, the myocardium, the endocardium. Now you see again, like I said, terms. You need to know terms. So you just take that section, and then what you do is you get a blank piece of paper. Just write it. Just write it down. Memorize it, okay? All right, then you have pericarditis. You have an infectious disorder of the cardiac system. All right? Peri, you go back. Peri is the outer layer of the heart wall. So you know we're dealing with the outer layer. It protects and secures the heart. So if you have fluid that's built up, you have inflammation. So you need to know what are the signs and symptoms of pericarditis. All right, so pericarditis, you have inflammation that causes decreased ability of the heart to expand and fill and results in reduction in ventricular filling, which decreases the cardiac output and blood pressure. So, if you get a question that relates to somebody that has a decreased cardio output and blood pressure, that should be a sign that we might be talking about pericarditis, okay? All right, so we knocked out the pathophysiology and the etiology. We knocked out the terms. So what do we do next? We go down to the signs and symptoms. So this patient might come into a clinic or the hospital and they might have chest pain. They might have fatigue. They might have cough. They might have orthopnea. Now, guys, I didn't even know what orthopnea was. So back to what I said with the terms, what do? You write it down. Orthopnea, that means you're laying flat and you have a hard time breathing when you get up, okay? So I didn't know anything about that. So it shows a picture here. So write it down. Just particularly write it down on this sheet here. I have bad handwriting. Okay. Okay, so remember what I said. When you find these signs and symptoms and the patient is diagnosed with pericarditis, you as a nurse have an intervention that needs to be done. So it makes it clear. Like I said, these PowerPoints are clearly from your book, okay? These are just shortened down, okay? You need to focus on pain, anxiety, and maintaining normal cardiac functioning. Now, on the test, it's going to have a question in particular. What type of pain management would you do for a patient that comes in with pericarditis? You sit the climb up. That's the first thing you do. You lean forward and you administer NSAIDs. Then you have anxiety relief, and you teach about disorders and treatment. Now, what did I say about once you do your interventions? You do nursing implication, and then you do health education. You teach them about this disorder once you treat them for their pain. Okay? All right. Again, we know signs and symptoms that a patient that has, but when you have complications of pericarditis, you should know the two that forms together is cardiac tamponade. So cardiac tamponade, again, you go down and you write down cardiac tamponade. After that, you write down what is the signs and symptoms of cardiac tamponade: restlessness, tachycardia, confusion, and tachypnea. Now, there's probably 10 more signs and symptoms, but like I said, in that book, you do not need to read every single thing, only what the teacher has given you. All right, so we're going to do one more to make you understand it. Again, get your sheet of paper, and we're going to go start from the beginning, your pathophysiology over thrombophlebitis. So you know that it's deep veins of the leg here. You know the terminology that is clot formation and inflammation with the vein. So you know it's superficial, you have DVT, and it's an emboli danger. So you just look at these pictures here. You just go over the basic A and P over this. You write it down. Those three little things. Do not go any further than that. Write it down. All right, so after we finish our pathophysiology, we go to the etiology. What is the cause? What is the risk factors? So you see that they give you a little hint here. Well, for me, it was C table 23-7. Now you see how this is all shortened out for me. Now, just to help you guys, I went back to the book. Now, this will explain why I tell you do not crack open that book unless they tell you to. Because when you go to the book, you go to 23-7, you see all this information here. It kind of makes it, hard for you to read and memorize all of that. Like I said, only focus on what the teacher has given you. All right, so how can we prevent thrombophlebitis? Again, you write that down. You manage immobility. You reinforce mobilization. You have the anti-embolism stockings here. Then they also give us a medication. Now on pericarditis, there wasn't a medication or anything that they put down on the lecture packets. Now there is medication. There's a procedure that you can go through, but that's not pertaining to what they want you to know for the test. You see how that works? There's more information that goes in with pericarditis and whatnot, but they only want you to know so little, okay? Now, thrombophlebitis, they want you to know what type of meds that you give. Because even today when I'm at work, we do the Levonex shots, particularly if you come out of surgery. We still do the Nexaprin shots, so you do need to know your medications. You need to know your medications here. So you administer anticoagulant therapy. It prevents thrombosis. You just put 2 and 2 together. Literally, that's it. Again, signs and symptoms. If a patient was to come in with thrombophlebitis, what would you expect to see? You will see, okay, hey, Dave has came into the clinic. On your assessment, you see that he rates his pain at 7. You see that there is an edema on the right leg, and it's warmth and it's redness and it's tender when you asked him that. You know that according to these signs and symptoms, we know this might be thrombophlebitis. So that's usually what's going to happen on the test. It's going to be something right here, and then they're going to say, well, if it's Pain, edema, warmth, or redness, we know that could be thrombophlebitis. How would you go about this as a nurse? How would you intervene? What do you do next? Okay. All right. So when you get into that process and the doctor gives you a diagnostic test. So like I said, you're going to need to know the pathophysiology, the etiology, the signs and symptoms. You're going to know the risk factors. You're going to need to know what type of diagnostic test. For this particular one, you need to know the medication. You need to know the diagnostic test. You have a duplex venous ultrasound, or you're going to need an MRI. That sometimes shows up on the test of what type of diagnostic test to get. You need to know which each test does. Define it. Write it down. Okay, so the goal as a nurse, when you have thrombophlebitis, what do you do to intervene? Remember, you are not a doctor. What do you do as a nurse? We do this every single day when you're at your clinicals. You elevate that leg. Now I can tell this was my second teacher that was doing that because I'm writing notes on it. You elevate the leg at heart level. That's going to be a question. What do you do to prevent clots? What type of medication? Again, you get the Levonex shots, Nexaprine. Now, one thing you need to know with Levonex shots, you have to know what type of side effects that come to that, or what can and what it can't do. Levonex has no effect on existing clots. I remember writing that down here. Levonex has no effects on the existing clot here. All right, y'all. So we have our diagnostic test. We have our medication administration. So while you are administrating these type of medication, you want to make sure that this patient is going back to normal. You need to get a what? A lab test. You need to assess for labs. So we know when you assess for these labs, particularly the Nexaprine shots or something like that, you do the INR here. So you need to know what type of lab value are you looking for, what's normal and what's abnormal lab values. So again, you got to go back to your lab values and you have to know what the numbers are. And I mean, know each number, what is good and what's bad. Write it down. All right, so another thing that I've done was brought out that old book. This thing right here, this big thing has been sitting in my closet collecting dust. I wanted to throw it in a lake, but y'all made me bring it back. You made me bring it back. One thing that you're going to need to know, regardless, objectives. Please. That's it. You really just need to know that. That's them basically giving you the answers here. That's it. Now let me show you. You see that 1, 2, 3, 4, 17, and it goes on to the back as well. It usually be like close to 25, sometimes maybe 50, depending on what subject that we was on. And you answer every single one. Now, what I did was, number one question, whatever they was asking, I would write it on another paper. And I would write it all down, something similar to this. Now, you could do flashcards. You can waste your time on that, and you can do hundreds of those, but you're going to be wasting your time during med surge. You're going to need to write it down quick, fast, in a hurry, or you can crack open that book, find it, and just highlight it. That's it. That's really it. That's all you need to do. Don't waste your time doing all those flashcards unless it's beneficial to you. You have nothing to do throughout the day. But sometimes I've been given subjects and had to test on it in another 48 hours. So, honey, get to cracking it right now. All right. Another thing that helped me pass my medical surgical nursing exams, and really towards the end where I was dang near ready to fail and everything like that, and I told you I was having these anxiety attacks. I mean, they were really bad, and I was having heart problems, and I told you that I was passing out a lot. Was this thing called Calm right here. I'm sorry if y'all cannot see it because this light is shining right on it. Calm. I would literally take about a couple of teaspoons. I would put it in a glass of water, 8 ounces of water, and I would down that at least an hour before my exams. I'm telling you that literally like nitro, gets you right back up, right back up. This was a lifesaver. I I would just really invest in getting this. You can get the packets, and it's literally like $1, or you can this big thing, so I don't have to keep going back and forth to the store, was about $20. But I keep this on me. I still keep this on me when I get nervous at work or something, or even when I'm in college and I take an exam, I still get nervous, and I just take this, and it calms me right down. Like I'm not paid or nothing like that. Like, this helps me. This is what gets me back up again. Okay. All right. Another thing that definitely helped me out was terminology. You're going to always need to know terminology, and it's not particularly for medical, surgical, nursing. It is the medical field in general. You need to know your terms because it's going to keep coming back on every single exam. So I'm going to have something towards my right or left, basically going over the terms that I had in my book. So sometimes I didn't even know how to even spell arthrosclerosis or brute cardiac output, clubbing, ischemic. All of that was kind of like foreign to me. It was Latin. I didn't understand any of that. You guys took anatomy and physiology. It was Latin. You didn't understand that terminology. It's okay. You can learn again. Go back to what you know. Find the definition, write it down. Now, if you want to do flashcards, do your flashcards, girl, but just write it down. Go over it every single day. Learn something new. Even if you have to talk to it with another person over and over again, just do it. Because it's going to come back regardless. And it doesn't have to be on one particular system in the body. It's going to keep coming back. It's going to come back when you go back to work. You're going to have to know these terms, and you're also going to need to know how to spell these terms. Spelling, you're going to need it. Okay? So please, just get your terms right. Okay? All right. So another one would be videos. Now, I'm going to recommend these two nurses that helped me definitely get through nursing school. Now, one is Nurse RN, and another one will be Level Up RN. Now, Level Up RN, I saw most of her videos. She really explained it in depth to me. Now, the more time that I would watch her videos is when I'm working out or when I'm taking walks. I would just listen to them and watch their videos. Now, particularly on the cardiovascular system, for the life of me, I didn't understand mitral stenosis or something like that. I understand pericarditis and everything like that. I understood the left and right pathways, but it would be something like mitral stenosis, and I was just having a hard time trying to figure it out in my brain of how this works. All right, maybe I needed to go back to like a child and get it written down. These two nurses would basically break it down to a T, and I would understand it than what a book is just telling me. Like, I couldn't just necessarily just read from a book and understand what they're telling me. Sometimes I just needed to look at it, somebody else tell me, and I grasp it. So, like I said, videos help me get through this. Okay? While I was working out, I was listening to somebody all the time. I was always, always doing work. All right. To add on to medical surgical nursing, what I did was questions. Questions, questions, questions. Now, if you don't remember, in school, at the end of each month, we would have to do 100 NCLEX style questions. Now, that reverts back to that Saunders book, that Saunders NCLEX PM book, and that website that you go to. I would do questions, and I would go through 100 of those, whether it be the cardiovascular system, the GI, anything like that, and I will go over 100. All right, for example, in NCLEX PN, I had the 7th edition. So we'll just do one question. The nurse is assigned to assist with caring for a client after a cardiac cath performed through the left femoral artery. The nurse should plan to maintain bed rest for the client in which position? All right, so this goes back to understanding what they are asking. So again, you need to know, why are we doing a cardiac catheterization? So you need to go back to your book or go back to your notes and know what the heck a cardiac cath is. Then you need to know, why is it going through the left femoral artery? That goes back to knowing what positions of the heart that we're in and what type of diseases that are associated and why we need to go through that specific artery in order to get this test done. And then we need to know why we need to be in this certain position post procedure, and that will give us our answer. So, high phallus position. That sounds like you're very uncomfortable. Supine with no head elevation. Again, back to uncomfortable. And again, where the left femoral artery is, we don't need to be laying flat. Left lateral sideline position. Now, I can't remember what it was. I remember it was specific to a puncture that's associated with the lungs, where you get on your left lateral side, but it has nothing to do with the heart. Supine with head elevation no greater than 30 degrees. That sounds like something that I'm very familiar with on any type of disease. Is usually that 30 degrees where I know to keep them supine. It's not prone or anything like that. It's always that 30 degrees what always gets me. So, we're going to see if that's correct. All right, so that is correct here. So, I don't even necessarily care for why I got that right, even if I got it wrong, okay? Even if I got it wrong, I need to understand this at the end of the day. Not necessarily this, okay? So, you read these rationales, and it'll tell you why you got it right, why we need to have them in that position, and what saves them from not going into like cardiac arrest or anything like that, from saves them from bleeding. This will all explain this of why you need them in that position. And then you just go on to the next question and you keep doing it over and over again. Okay? You're going to need to know it. Like I said with my NCLEX, I didn't focus on just getting the answer correct. I needed to know, why did I get it correct? I needed to know why this person was anemic. There's always an answer to it. So please, don't just answer and memorize the answer, click it, go to the next. No. Click it, go down, read it. If you do not understand it, go back to the book, read it. Or you can go back to the 2 women that I can refer you, and then you could go to a video on it and have them show it to you in less than 15 minutes. It will not hurt you to go back to it. Do not skip that, okay? Please, rationale. Just put it in your head, rationale, okay? Another one is the library. I need you. I hated being in my room. Like, I hated being in a room. I just now started liking being in my room. Nursing school makes you on the go all the time, Monday through Friday, all the time, weekends, you're working, all of that. The only time where I felt like I had true peace, I didn't really feel comfortable in my own home for some odd reason, was the library. Just go to the library, get you a room in particular. Like, sometimes I would go to a big college or something like that, and I would request a room, and I would just be in pure silence. I wouldn't even listen to music. I was so focused. So I would recommend just going to a local library if you can, or going to a college. Stay up all night there. I promise you, time will pass and you will begin to grasp everything. It's better to be in an environment that is not so familiar to you, and that is quiet, and that's just free from distractions. And what I got out of that was being in the library. I found a love to be around books and, other people that think like me. So I would just go to the library, please. Alright, to end this video would be to limit your external stressors. Once I went into nursing school, y'all, I cut off everybody. Not even gonna lie to you, I cut off everybody. Mama, daddy. The only person that I was really in contact with my sister. I didn't party or anything like that. I wasn't out in Cabo. I wasn't trying to really go to kickbacks unless we had like holidays. But even then, I didn't even want to do that. I wanted to focus solely on school. So like I said, all of that has to stop for the 12 months that you are in school, is to limit your external stressors. If you're having, I don't know, say baby daddy, baby mama drama or something like that, or your family is just working your last nerves, you might just have to cut them off to get where you need to go. That's what I eventually had to do. I had so much stress on me, whether it be in bills or family or somebody that I was like dealing with, they got cut off. If you had stress, if you brought me stress and you were not adding on to my life or anything like that, You were not helping me. You was not being beneficial. You got cut off because you did not help me with my success or anything like that. You're hindering me at that point. So like I said, limit your external stressors. You need to eat right. You need to drink right. Please, for the love of God, please, y'all, go over exercise. I have a trail outside and I try to walk out as much as I can. Go work out because I'm telling you, you don't want to gain this weight that nursing gives you. Please try to at least get 30 minutes a day back in, okay? But like I said, hopefully this helps y'all. I wanted to just cut this so short and get it out the way. I am going to do how I study farm and how I studied for the mom and baby. Those are quite a little bit different than medical surgical nursing, but hopefully this helped y'all. But y'all have a lovely day, okay?